officially.
Podcast, so perhaps I should be pressing record a little bit earlier. So now that we are officially recording, welcome to the G&T Sessions. I am Tess Crawley and my co-host Gerda Muller. We are both psychologists, practice owners, business owners, entrepreneurs, and general chatterboxes. So welcome. This is our first episode back together for nearly a couple of months. Been a while, because as many of you know, I've been somewhat unwell, and I'm tentatively venturing back into the public space as my voice gradually recovers, and it's fun times. It's fun times. It doesn't take much to get Gerda and I giggling, so that's always a good thing. That's always a good thing. Yes. All right, Gerda, what are we talking about today? We're just going to chat today. I think we're going to be talking about whatever comes to mind. Probably should be keeping an eye also on questions in case we get them. That's probably another thing to be watchful for. But overall, we are, I guess, sharing some similarities and differences around what's going on in our separate necks of the wood. Gerda's in Queensland. I'm in Victoria, in Melbourne, in Victoria. And as most people will know, I don't know if it's been officially stated that we're having a second wave of coronavirus here in Melbourne. We have a couple of hotspots, so very specific suburban areas of Melbourne where there are outbreaks. So not the whole of Victoria by any means, but it's got people asking questions. I'm noticing already this morning some Victorian private practitioners asking, should we be going back to full telehealth? Some people never stopped doing telehealth, some people never stopped doing face-to-face. And of course, the answer is whatever you feel right doing is right for you. That is the right answer if it's right for you. But things in Queensland are getting back to normal? How are things going with your teams?
Well, I must say, first and foremost, I'm very fortunate that where I live, as far as I know, we have not had one case, but I am living rurally, of course. Which is really awesome. I mean, in Brisbane, it's the same. At my practice, some people have been doing telehealth and others haven't. Because we've got contractors, they get to decide how they provide the service. So that was up to them. And we supported whatever decision they made. We also, made recommendations to them, but ultimately it was their choice. So we had quite a number that decided to do telehealth. And then we had also quite a number that decided to, continue with face-to-face appointments, of course, still adhering to all the social distancing, wiping down stuff. We've got cleaners coming in lots of times, like more than double the normal amount of time and all of that type of stuff that gets done. In terms of more clinicians going back, we've probably had around 2 that were previously telehealth come now back into the office, which is perfectly fine. We also give clients choice. So sometimes we would have clinicians at the practice, but the clients are still choosing to do telehealth. And of course, that's perfectly fine as well. I think most people need to make this decision themselves. It's a very personal decision, which when it comes to stuff that impacts your health, and that of your immediate extended family and our community and all of that type of stuff. So obviously, we want to support that as much as possible. But yeah, slowly but surely plans are being made to get back to the normal or as much as possible, as much as we can. For example, Halo, practice management, my other business, we were completely remote. So we did that very early in the piece, all our people working from home, set them up in that way. And now we're looking at actually getting new office space, because we just had like month-to-month office space. So we could just drop that after that first month. And now we're looking for new office space to slowly start transitioning people back again. But very tentatively, because look what just happened in Victoria, right? And
That's it. That's right.
We expected that there's going to be a second wave. There's always been talk that something like this could happen. That's why we haven't rushed into anything. Although we want to rush, we want to get back to normal, but that's not reality.
It's not reality, and it's what, you know, Dan Andrews, Premier here in Victoria, is saying, you know, just because we want it to be over doesn't make it so, and that we have always anticipated that there would be outbreaks and theoretically a second wave. I saw this morning, you know, the talk about in America, they're quite fearful. It was a post actually, I think, by a doctor who was saying he's quite fearful about medical staff burning out because they're in the middle of summer over there, and they're quite fearful about what's going to happen in wintertime when they get to where we're at now in terms of, you know, midwinter with flu and coronavirus still around. One step at a time, but you know, it could, what's happening in Melbourne could happen anywhere. You know, we've got a couple of outbreaks caused by you know, cross-family transmission. So, you know, people who've been socializing because restrictions were easing and because people were desperate to get together, and we are social animals, of course we want to spend time together. So interestingly, not linked to the Black Lives Matters protests, which is an important, you know, important thing that I think a lot of people have mistaken, that that's what's caused the outbreaks here in Victoria, but not so. It's actually families getting together and someone within those family groups being having coronavirus, spreading it around.
You know, for years and years, when I was still living down in Brisbane, I had my GP, Dr. Kumar. And he was the first GP that I got when I moved to Australia, and I stayed with him for many, many years. Just most amazing doctor. And he always, you know, encouraged me to have the flu shot, because he always said, Gerda, you're a helping professional. You work with people every day. You see at least 6 clients a day. You need your flu shot. And he always said that you need to get your flu shot before Easter weekend. After Easter weekend, it's too late. That was his thing. He said, because what happens Easter weekend? Families get together, right? Families congregate, and that's when most people pick up the bug, right? When most people get the flu is as a result of Easter weekend contact, which just like makes so much sense. So for me over the years, that's always been like my marker. I need to get the flu shot before that weekend, or it's not going to count. I guess it still will help, right? But that was the principle of it, that when we get together with close friends and family, where you're going to sit on grandpa's lap, your grandchild's going to sit on grandpa's lap, you're going to be in close proximity, cooking maybe in the kitchen with the other people, or around the barbie. You're going to spend a whole day together, you know, or a whole evening, and it's that close proximity for an extended period of time that causes stuff like this to spread.
That's right. And that's actually, you know, that's right. I mean, one of the messages that we've been getting here in Victoria is, you know, it's not from going to the supermarket, it's not from going to the shop or the park, or you know, going for a walk. That's not how this outbreak has happened. It's happened from families getting together, and unfortunately a couple of people going to work when they were unwell. Well, they had symptoms, but mostly because of family gatherings. And I can't remember who was saying it. Basically, you know, the big message for people to get is, you're not going to catch this from strangers. You're not going to spend enough time in close proximity with strangers overall. You're mostly going to catch this from other family members. So this is a message about protecting others. And I think also, you know, in terms of vaccinations, once there is a vaccine available for coronavirus, I have the same belief about, you know, things like the flu shot. When we are health professionals, and when we are we're in a public facing role where we spend a lot of time face to face with members of the public, I actually think it's our responsibility that we have those vaccinations so that we're not potentially passing things on to other people. So hopefully, you know, hopefully before the end of the year, they'll well, I don't know when there's going to be a vaccine, but you know, we're all hanging out for that, I'm sure. But we've got school holidays have just started. So today's, you know, we've just got 2 weeks of school holidays in the middle of an outbreak. So we'll see what comes.
My kids have got 3. They've already been on a whole week of school holidays. They were very happy when I said, Mummy's going to be on a podcast with Aunt Tess. I could still call you Tassie Tess, right? Although, you know, but then they know who I'm talking about, right? So no interruptions, and they go, yes, a full hour of uninterrupted iPad time, right?
That's it. My kids love it too. They absolutely love it. They love it.
Yeah.
I think one of the things I was going to mention too about just talking about our teams and things, the experience. I've got this interesting scenario. Of course, I'm in Melbourne, but my team is in Launceston. So most people know I had two practices, one in Hobart, one in Launceston. Sold the Hobart one, which is doing well, and the Hobart practice never stopped offering face-to-face. So they had a mixed model, and my Launceston team, when I say I call them my Launceston team, but they're actually quite spread out. So I have admin and a psychologist in Launceston. I've got a social worker based in Bicheno on the East Coast and a social worker based in St Helens on the East Coast. And then my practice manager, Lindy, is based in Hobart and I'm here in Melbourne. So we're very much a geographically mixed business.
Yeah.
We went to full telehealth very early on. And are still on full telehealth. Tassie hasn't had any cases for over 40 days now. And the plan for my team is to return to face-to-face, or to continue offering telehealth. We've always offered telehealth as an option, but to continue offering the option, but availability of face-to-face from next month. And we will obviously keep a close eye. I do still keep a very close eye on what's happening in Tassie in case there's any changes, but we'll see. So they're now champing at the bit to get back into face to face. So they were hesitant for a while, and I completely understood that. But they're now champing at the bit to get back in the face of people, because it's why we do what we do, isn't it? Helping people and being social creatures.
It is. It is, exactly.
Mm.
And I guess all this talk, telehealth, flu shots, viruses, I guess it brings up the whole topic of our health, right? I mean, you started talking about this just randomly before we came on in terms of all of this is all these red flags, right? In terms of going, maybe it's time to spend more time looking after our personal health, because it's so important. And you've just experienced that, right?
I'm still experiencing that. Yeah. So like everybody else, I noticed right at the start of coronavirus, I noticed that I would get this really sore throat, and I'd do the, have I got coronavirus? And then I'd realize it was Wednesday, right? And Tuesdays are my big talking day. And it would always be on a Wednesday morning that I'd notice I had a sore throat. So I started passing it off as, that's just the Wednesday sore throat thing. And then it gradually got worse and worse, to the point that I started having difficulty swallowing and all sorts of stuff going on. So was forced really to go and get that checked out. Now, thankfully, that happened, because what then was revealed was that, well, first of all, I've got a weakened vocal cord. I'm now working with a speech pathologist to get that sorted out. No nasties in my throat, nothing to be worried about, just like a weakened muscle that you need to build the strength back up in. But a series of blood tests also revealed that I'm seriously anemic. So I would never have picked that up, because April was such an intense month for everybody. And I remember April distinctly, because it was backwards and forwards with Medicare, so much uncertainty, not knowing what was happening with coronavirus, not knowing what was happening with lockdown. Everyone was in a mess. And it was like from the 6th of April, when I think the COVID item numbers for Medicare were released, through to something like the 24th of April, when it was the rules around COVID-19 item numbers were relaxed. That intensity in those couple of weeks, in terms of the amount of support that I was giving to people, the amount of stress a lot of people were feeling. When we came out of that, I was still feeling really fatigued, and was passing it off as coronavirus stress. Everybody was telling me, we talked about this on the podcast, everybody was talking about how exhausted they were. Everyone was talking about how they couldn't sleep. It was a really intense time. Thankfully, I found a fabulous GP here in Melbourne who insisted I have some blood tests, and that's how we discovered the anemia. And so I'm in the middle of having iron infusions at the moment to fix that. But if it hadn't been for the throat issue, I would never have had the blood test, would never have discovered the anemia, and would have gone on assuming oh, it's just coronavirus stress. Everyone's corona tired. Everyone's corona stressed out.
Yeah.
Me too. And I wouldn't have looked into it. So what I'm grateful for is that since talking publicly about this, I mentioned this to you earlier, since talking publicly about this, you know, I've had a number of business owners and health professionals contact me telling me, thank you, you've actually prompted me to go and get my health checked. And a bunch of those people have discovered that they had either iron deficiencies or other vitamin deficiencies and are getting those treated as well. So I think it's timely. I'm doing a series of posts at the moment of things that, using the change of financial year, to think about a whole bunch of things, not just your tax, but think about all the important relationships to your business and so on and so on. And one of the things we need to be thinking about is our health, but also how, you know, if our health fails and we own a business and our health fails, what happens? Like, what have we got in place? What's our plan B? I've spent, like you, I've spent, you know, a good a number of years building my business so that if I got hit by a truck tomorrow, the business would continue, and that's fine. But so many of us who rely on, so many business owners and practice owners who rely on themselves to be the major revenue source. I think it's time to be thinking about your health. Make sure you're getting it addressed. Make sure you're identifying anything that needs fixing, but also look at your insurances. Make sure you've got your income protection insurance up to date. Make sure you've got business expenses insurance up to date, and so on. You know, look at all the life insurance, whatever. Make sure you're getting all those things checked on an annual basis. I think it's really important. I joke that every year on my birthday, the very first phone call I get, without fail, not my mother, not my nana, my insurance broker rings me every year on my birthday, and he's always the first to call me. And that he uses my birthday as an opportunity to review. And I'm not going to talk to him on my birthday about insurance, but, you know, make a time later to talk to him about my insurance. We need to do these things.
Yeah, it's so important, right? It's so important. And I mean, I'm embarrassed to say that I, for many years, was very, very bad with that stuff, right? Yeah. And I think what happens in the early stages when you're a solo practitioner or you're in that stage of building your business, it's always like, I don't have the money to put towards something like that right now, right? It's not high up on the expense priority list of expenses. Like, it's more important to pay for your FBOS or your whatever, right? All those other things. So I guess I lived very dangerously in the start. I guess to some extent, I always thought that there was a bit of a safety net with income protection through super, but we know that it's probably not enough. And there's a lot of restrictions around the income protection that you get through your super. And I've gone through that process, and I will, I probably shouldn't, but I will admit that I still today don't have income protection, not specific, not for income protection. I still have it through my super, you know, life insurance, that's a different thing. But I'm talking about from when you get hurt or whatever, and you can't work, or, you know, you have a diagnosis that requires some type of treatment. I've never had it, but I'm in a fortunate position that I can still pay myself, even though I don't work, right? Yes. But that's because I'm now at this level. That's right. So it's like in the start at this level, I didn't have the money. Now I don't need to do it because I can still draw income from my practice, whether I work or not. But there's all this in-between stages where, looking back, I took a really great risk not having that covered. Right. And, you know, I can give a lot of excuses for that in terms of, you know, I always invest my income back into the business. You know, I'm an immigrant, so I didn't have any money, all of that stuff. But at the end of the day, it's still a humongous risk that you take. And we know that stuff happens every day. It stuff happens every day.
It really does. I used to work in vocational rehabilitation, and I would see a lot of people who were on either workers' compensation or income protection insurance programs. That was what was paying for me to be involved in their care. And I think the example that really stood out for me of why income protection insurance is so important. So I'm employed by my business. And so of course I've got workers' compensation coverage. But I remember there was a fellow who was, I think he was either a painter or a plasterer, or a builder, something like that. And he injured his shoulder playing backyard cricket one summer. Now, luckily, he had income protection insurance because workers' compensation would never have covered that, because he wasn't on the work site when he was injured. And it really got me thinking about the differences between income protection and workers' compensation, but also trauma cover. I've talked before about how my husband is a cancer survivor, and thankfully we had trauma insurance, and he received a payout, which overall meant that he actually he had 6 months of treatment where he didn't work. He went back to work full time, I think too quickly, and he would admit that too. And then hit a wall and had to pull back for a while. And luckily, we had that payout there that gave him the flexibility to do all of that, to try going back to work, it not being ideal, and then sort of tweaking how that looked. I wouldn't like to have been in that same pressured situation of him going through treatment and also have financial pressure. And I think as business owners, that's it's stressful enough, finding the money to pay bills and all of those sorts of things. But if you can't work and you're the major revenue stream for your business and you can't work, thinking of the stress that puts on your family, that's the guilt trip. I think that's where, you really have to think like that. You have to think like that. But there's so many insurances that you could have, and you don't have to have them all. But I think a good broker, like someone that's recommended to you by someone who's happy with the broker that they've got, and then you can have a good conversation about what do you actually need, what do you not need, and so on.
Yeah, most certainly. It's so important. And, when things happen, like you've just gone through, your health, I'm not sure that we call it a health scare, or, to some extent, where something just stops you and say, listen here, you need to do something. And, I went through that similarly last year with my very bad iron deficiency that I had as well. You don't want to wait for that to happen, because it could be so much worse, right, than an iron deficiency. Iron deficiency is very annoying. It's awful, right? But there's a lot more worse stuff that might be able to stop you dead in your tracks. So it's really important to actually look at your health stuff and have those iron studies, full blood tests, but they need to specifically ask for iron studies as well. Because the fact of the matter is that as business owners, right, and as parents, we've got so many work roles, and we push ourselves so hard to work and work and work. And I very often relate it to what I see in our clinical clients, that it's so often that clients will come in for their first session, and they give you a bit of a description of how they're feeling. And I actually do this exercise in the second session once they've done the DAS at session 1, and I'm ready to give them their feedback, their results. I will ask them to self-reflect and tell me, so where do you think does your depression score fall, for example, or your anxiety score? Is it normal, mild, moderate, severe, extremely severe? And 9 out of 10 people will suggest that they're falling lower on the symptom scale, right? Whereas the actual scoring results put them much higher. And that's because they just get so used to that this is what their life is like. This is, anxiety is just part of my life. Depression is just part of my life. And they get used to it. And I think the same happens with that feeling of exhaustion often, when we've got so many life roles and so much, pressure and responsibility on us, that you just start to think, well, I'm tired because I work so hard, or I've got all this stuff on my mind and on my shoulders, right? So the day that I went in and got my test results, the doctor said, I can't believe you're sitting in the chair. Any other person with these, like they couldn't even read my results, it was so low, will be in bed. And I said, well, that can't be. I was at the gym this morning. Are you sure those are my results, right? that can't be. You need to double check. But because I'm a creature of habit, I do what I know I need to do, right? And it's because I've just gotten used to, of course, I've got 3 kids, you know, sometimes I'm up at night and I do all these things. So of course I'm going to be tired. So you just push through and you just push through and you go, oh, it will be better tomorrow or it will be better next week. And then before you know it, it's been another 2-3 months and it's still exactly the same.
That's it.
It's so insidious, these type of things. And I suspect, I'm not a doctor, but I suspect when you get to a certain age, right, you're also going to be more prone to these type of things because your body might not work as well at producing all this stuff that you need, right? And maybe there are some health concerns that you've just been carrying along because you've written them off as not as important, or I don't have the time to deal with it now, and then it all starts to accumulate. So it is so important to make this time to put yourself first, just for 20 minutes. Do it telehealth session if you need to start with, or go and see your GP and get a full workup done, because it could literally change your life.
I think you're right, and I think that where we're lucky at the moment, I think taking advantage of the moment is really important. You know, not just the story that I tell and using that as inspiration to check your own health, but also the fact that we've got access to telehealth for any of these sessions that you might need. Obviously, you can't have a blood test via telehealth, but you can have an initial consultation. You can have the conversation with your GP. All of that stuff can happen. I had a couple of weeks ago, I had an 8 a.m. GP appointment on the telephone, a 9 a.m. speech pathology session via Zoom, and then a 1 p.m. face-to-face, throat specialist appointment. You know, all the variations. So those 3 appointments were so easy to do 3 appointments in a single day because I wasn't having to drive all over the place. You know, I only had to leave my house once to have 3 different appointments. So taking advantage of the situation we're in now, where so many health professionals are offering services either via phone or telehealth, it's such an important thing to, you know, not just offer it to your clients, but also accept it for your own needs as well. And I think, you know, we do take on a lot. We take on a lot of responsibility. We live with a lot of risk with our businesses, and our health usually takes a backseat to all of that. And I think that that's not the best move. We really need to stop and check in with these things and get, you know, and sometimes we're let's be honest, sometimes we're avoiding because we're a little bit fearful of what the test results might show us. But we just need to put on our grown-ups pants and make sure we're getting the nasty things ruled out just as much as, you know, anything problematic ruled in.
Just get it done and take it one step at a time. That's all you can do, right? And then you know. You can't fix anything if you don't know. That's
exactly right.
That's just my philosophy. And also, you know, you work so freaking hard, you want to be able to enjoy the fruits of your labor as you get older, right?
That's exactly right.
That's one of the reasons I like to keep active and fit, because I do not want to be old and not be able to get out of my chair. I want to be able to do stuff. Right? Spend time with my grandkids, still walk on the beach, and be, my body needs to be as able and as ever, including my mind. So you want to enjoy when that time comes, but you also need to enjoy life now, of course. But you know, I'm not ready to retire fully. Not sure if I will ever be. Highly doubt it. I'll always have my finger in the pie somewhere.
I'm secretly taking bets on how many businesses you'll have before you die.
Yes. I can probably start quite a few, just like today, but I won't. I'm keeping myself very contained. I must say, absolutely loved last week. So you would have seen, I had Abby here, my PA. I had Chelsea and Ash.
I was actually jealous. I was actually really jealous. not so much, I mean, jealous because, you know, it looked so wonderful to have your team all come and hang out with you, and it did get me thinking about, you know, further down the track, you know, further away from coronavirus, because well, no one wants to come to Victoria at the moment, but not only that, you know, to go back to Tassie, my team would have to be quarantined for 2 weeks at the moment if they weren't to fly back in. You know, further down the track, and I haven't even talked to them about this, but further down the track, you know, I'd love to have little get-togethers, you know, here, little workshops and all sorts of things, but also, you know, looking at what I do in this space and, you know, the team I'd like to build. You know, I'm working with a few collaborators at the moment who are all remote, and some of them I've never met. You know, the lovely artist Olivia, who is doing these animations for me, and I've got two more. I've just got two new ones, and one of them I'm going to release, and the other one I'm saving for NAIDOC week. And I love working with her so much. We both get such a giggle out of what we're doing together. We've never met, but we will one day. But this idea of having a team that, you know, can bring together occasionally, sit out in the sunshine and brainstorm and work together. I think one of the things for me, my husband keeps asking me if I'm stressed, and and I say I'm not stressed, I'm frustrated, because I will have slowly getting a bit better now, but through this period of health challenge, I still have all the business ideas that I would have any other time, but had no energy to implement anything, and had no voice to do live streams really or anything like that. So it was so incredibly frustrating not being able to action the things that I wanted to. My book's on hold for the moment, and all of those sorts of things. Knowing that I'll get to them is one thing, but the frustration in the moment is the other challenge that I've been facing. But I'm not known for my patience, Gerda.
I get it.
Patience at all.
Totally get it, but it will get done. That's what I always tell myself when I look at my to-do list as well. You know, it will get done. It will get done. And yeah, it was so amazing having, you know, you can connect with people like we're connecting now, right? It's awesome. It's great. But actually having somebody also in your physical space, like from early in the morning, you know, even late till night, and just chatting about everything. And it's a different brain space. I think it's a different brain space, being in the presence of another human that you get along with and that you get excited with, and you share visions and dreams with, which was really awesome. And when they left, we've already got plans to meet up again, right? Because we said what we get done in that short space of time together as a collective is just it sees us through the next 3 months, and then we can just have these check-ins and all of that type of stuff. So it was really, really awesome. I was even thinking of going, can I bring them to the Tess's retreat when that's happening? Is there going to be space for them?
Well, you know, the sad thing about the retreat, do you know what's cruel? What's cruel about my midwinter retreat, which now is scheduled for mid-spring, is that, you know, I'd sort of realised a while ago, like at the start of coronavirus, that having it in Tassie was probably unreasonable. At that time, most of the attendees were based here in Victoria, and I thought, well, I'll have it in Victoria. I've got a fabulous hotel where I celebrated my birthday. I've got them all lined up. We're going to have it there. And now, of course, we've got the outbreak here in Victoria. Now I'm back to square one of like, and but this morning on my Facebook memories, a live stream popped up, and I actually sat and watched it. It was a live stream from a year ago when I was shopping for all the treats I was going to be providing last year's attendees, and all the lovely little Tasmanian delights that I was going to be providing for them. And it kind of rubbed my nose in it this morning that I am really missing that excitement of the midwinter retreat. I do love midwinter retreat. It's such a good thing to do. If we have it in Victoria, well, then the hotel, and if coronavirus, or maybe this will be next year too, theoretically coronavirus will be gone. You know, the Victorian hotel I've got in mind, numbers won't matter. So if you wanted to bring your whole team, then that would be fine. But who knows what's going to happen between now and September, because I certainly don't.
And that's the thing, right? And even with Elevate, I was thinking, you know, we postponed it to March next year. Of course, we're having virtual Elevate the end of July. Yes. But then I keep on thinking, oh, should I have kept it for the end of this year? And it's like on and off. And the uncertainty would have just been awful. So, it's hard. It's hard. But hopefully basically, I think, you know, by August,
I will make a decision about whether or not the retreat, whether we have do a similar thing with what you've done with Elevate, where people who've paid for this year's retreat get next year's retreat in person, and this year have a virtual retreat for no additional cost, something like that. If I need to, then that's a conversation I'll have with them. We'll come up with some creative solution. What I do love is that the people who put their hand up to come, they're being very patient, because obviously we're all in the same boat. So they're being very patient and waiting to see one day it'll happen. It'll be like a family reunion. We'll all be so excited to finally come together, because it's been it will have been a very long time coming.
Yeah, and I'm happy just to keep all the potential dates open in my diary and come at the drop of a hat. That's not a problem at all.
Oh, good.
Because it's worth it.
Oh, good. It is worth it, isn't it? It's those things, those times when we take time out. And I think for my Like a Boss cruise and my inner circle, we were due to have our August retreat the weekend after your Elevate conference in Brisbane. And 3 of my Like a Boss heroes based in Brisbane, and so we're going to have a virtual retreat for them, but the 3 of them in Brisbane are going to retreat together anyway somewhere nice.
Nice.
To make me jealous. I know, so I'll be very jealous. And the rest of us will just gather virtually and get I'm excited actually to see just what gets achieved virtual format, because I think we can actually get quite a bit done.
Oh, most certainly. My last 2 inner circle retreats now had to be virtual as well. And, in terms of productivity, still 100%, right? In terms of the learning and the values and all of that stuff. But what I miss is the social get-togethers and, that type of stuff. There's things that really make the experience so much more special. But it is what it is. We all are having to make sacrifices. And when you have amazing clients that understand that that's the case, and that these things are beyond our control, that just makes myself, and I'm sure you as well, so much more grateful for what we do and the amazing people that we get to work with, right?
That's exactly right.
So this year is so interesting. There's going to be books written like yours about the year 2020 and all the shit we've had to go through, but also all this stuff that we've learned from it and took away from it, right?
Well, that's right. I mean, I sort of grumble that I've had to put my book writing on hold while I get my energy and attention level back up to normal. But there's actually the good news is that watching what's happening in Victoria, and the businesses that I will be including as case studies in my book are going through all of this fear of a second wave and what's that going to mean. I had such a fascinating conversation with a restaurateur who was saying that the fact that they were ready to go up to numbers of 50 in their restaurants from the Monday, but got the word on, I think, the Sunday that no, we were sticking to 20 in restaurants. He was saying, look, all we can do is we know what we're dealing with, like we know what numbers we're going to have. We know that we're booked in advance. We know that those numbers are booked out. So we know it's going to be worth our while opening for that many people. And he said, and the good news story is that so far there's been no cases linked to hospitality. Nobody's caught coronavirus from being in a restaurant, so so they're feeling optimistic and positive about what will eventually happen, and just riding it out. And so many businesses have got clever little side hustles that they've pivoted into to support themselves during this period of time. So like those private practitioners who are saying, well, do I go back to full telehealth? Do I bring face-to-face in? What do I do? Umming and ahhing. A lot of what I'm talking about at the moment is don't be afraid to hold steady. Don't be afraid to just stay the course for now, because there's still so much that we aren't in control of, that we can't know the outcome of. And if you've got something new that you're doing for your business and it's working, well, don't give up on that too quickly. The restaurants that are doing the little at-home versions of menus, the restaurants that have got little corner stores, Even beauticians that are offering online tutorials and pay, little private tutorials. If you've got all that stuff happening, keep those revenue streams going because it's so important.
Yeah, 100%.
Try and write it out. We'll see what comes.
Awesome. Well, it is 1 o'clock.
I know. I should stop talking.
I'm drawing the line because we are not here to exhaust your vocal cords. So
thank you.
It's all good, all good. We know we can talk the whole day, and we already started talking at 12, only went live at 12:15, and said,
right.
hang on, we need to just press live because otherwise we'll still be here chatting by 1 o'clock.
True.
Yeah.
All right. Well, thank you. I'm gonna stop recording for the podcast. So thank you everyone for joining us on the G&T session, and we expect to be talking to you again in a couple of weeks' time. We're hoping that we're back in the swing of things now. So we'll talk to you again soon. I shall stop recording and ciao for now.
Okay.